I'm Kayla Fox, and this is my patient with polycythemia vera. Most people have never heard of polycythemia vera. Polycythemia vera, which can be called just simply polycythemia, is a disease of the bone marrow. It is caused by a mutation of the JAK2 gene in our body. This disease causes an increased production of red blood cells. However, there might also be an increase in white blood cells as well as platelet levels. With these increased levels of blood cells, the blood is then thickened. Thick blood cannot circulate throughout the body to different vessels properly. This can be known as hyperviscosity. There are many symptoms that can be associated with polycythemia: dizziness, difficulty breathing when lying down, and also shortness of breath. Fatigue, GI problems, increased bleeding, redness of skin, and weakness of extremities are also things that one needs to be aware of with polycythemia. Treatment for a patient with polycythemia focuses on reducing the amount of blood cells. It also involves eliminating as many signs and symptoms as possible. One treatment option is phlebotomy, which they draw a certain amount of blood out of your veins. For those who are not cured by phlebotomy alone, certain medications are used. Such medications used include hydroxyurea, engrelide, and interferon. Even a low-dose aspirin, such as 81 milligrams, can be used to reduce the risk of blood clots. Polycythemia can have an effect on one's oral health. Spontaneous bleeding can occur during the treatment process. Poor oral hygiene is also associated with someone with polycythemia. Thus, their gingiva is inflamed and periodontal disease is usually evident. Purple to reddish areas on the tongue, lips, and gingiva regions can be seen by the certain patient as well. Overall health is hand in hand with one's oral health. Thus, poor oral health habits can induce more bacteria that can lead to infections. Since a patient with polycythemia has a weak immune system, it is important to minimize the amount of bacteria in the oral cavity so it will not track to other parts of the body. So let's meet the patient, Regina George. The patient is Regina George, and she is a 68-year-old Caucasian woman. Her medical history includes polycythemia and currently stable angina. Her medications include Hydrea 500 milligrams once daily, Pepcid 75 milligrams once daily, nitroglycerin 0.4 milligrams 3 times daily whenever needed for angina. She also takes a baby aspirin of 81 milligrams. Her functional level is 1. She can do things by herself and needs no assistance. Her recent dental visit showed that she was a periodontal classification 3. Her pockets were 3 and below, however she did have a couple of 7s in the mandibular right posterior sectant. Difficulty with B, ASA 2, bleeding score of 67%, plaque score of 45, and her serious risk assessment revealed that it was very high. The 4 medications Ms. George was on only had a few oral side effects. Hydrea can cause unusual bleeding, sores in the mouth and throat, redness of the skin. Pepcid, for the GI problems that she's having, is sensitive to lidocaine doses, so take caution when you're using any kind of local anesthetic. Nitroglycerin has no known oral side effects to be aware of other than slight xerostomia. Aspirin, of course, as most people already know, causes increase of bleeding. So looking at Ms. George's clinical assessment, her dental history includes extractions, restorations, and also she has a bridge on the mandibular left posterior sectant. She did have an abundance of bleeding on probing, and her gingiva has generalized edema and erythema. She claims to brush twice a day with a manual toothbrush and flosses maybe once a week. She was put on a 3-month recall, but currently she only comes every 6 months. The patient, Ms. George, did have some complaints. She explains that her gums always bleed when she brushes, which is twice a day with a manual toothbrush. Her gums seem to be disappearing on her lower teeth, and her mouth is sore and really dry when she wakes up in the morning. Ms. George's diet is as follows. She eats 2 healthy meals a day usually. She likes to snack in between on sweets and sugary foods. She loves her sweet tea and drinks about 6 glasses a day. She also sucks on hard candy to help with her dry mouth. So let's get a care plan together. First, it is important to first minimize bacteria, bleeding, edema, and further spread of her periodontal disease. This will help take care of most of Miss George's complaints. Bacteria is the star of all the problems above. During her appointment as a dental hygienist, I would make sure to thoroughly clean and debride all teeth from any and all calculus and plaque. This will leave the patient with a fresh start. It is important to explain all side effects of polycythemia and the medications Miss George is currently taking. Thus, Miss George is aware of how it is affecting her oral health and overall health, i.e. the increase of bleeding and the dry mouth. In addition, periodontal disease needs to be explained to Miss George. She needs to be aware of her condition and reassured ways to help treat it. We need to make sure Miss George is taken good care of. We need to switch her to 3-month recall and make sure she is keeping up with her appointments. This will help minimize the growth of periodontal disease. Also, as a hygienist, we can work through and show Miss George adequate oral hygiene instruction and give her encouragement to maintain these. She is having a recession on those lower anterior teeth that she says that her gums are receding. Show her proper brushing techniques to ensure she is not brushing too hard. Also give her advice to use a soft bristle toothbrush. As a health provider, we need to pay attention to any further changes of her medical history. Things are subject to change, and medications can lead to different oral side effects to be aware of. You can inform this patient to use Tylenol for post-procedural pain, since NSAIDs are a contradiction to her medications she is taking. Adapted devices for this patient to use is a powered toothbrush with a soft bristle head. Since she was having a lot of the toothbrush abrasion on the lower anterior, we want to make sure that we give her a soft bristle toothbrush instead of a hard one. Show Miss George an example of one and how she can really help her to reach and keep her teeth cleaner. Also show and explain to her the use of super floss and floss threaders for under her bridge. Show her with a mirror, then give it to her so she can show you that she is using it appropriately. To decrease the bacteria count in the patient's mouth, it is important to use an antibacterial mouth rinse, which would be a great option for Miss George. Since Miss George struggles with dry mouth, an alcohol-free mouth rinse such as Biotin and Listerine Zero can be used. Also, if you want to introduce to Miss George a sugar-free option for candy instead of one full of sugar, and also after all that sweet tea that she's drinking, have her just to rinse with water just to have her mouth clear of any of that sugar. It is important as a dental hygienist to work on improving the quality of life of a patient. Oral health can affect an individual physically, emotionally, and pretty much any way you look at it. Improving oral health habits can lead to overall health improvement. It all starts in the oral cavity. It is important to show empathy and true concern for the patient. Let them know you care and that you are here for any help. See how their oral hygiene is improving with each recall appointment. Let the patient know that they don't have to be overcome by their disease, like Miss George with polycythemia. A disease doesn't have to run your life. And here are some of the resources I used for the patient with polycythemia.